Hey everyone, it's Ryan, and I want to talk about what's #1 trending right now on Google, and that is something called Kawasaki's disease and its potential link to the coronavirus, and essentially its complication in children. Now, we've said that children are basically unaffected by the coronavirus, and most children have very mild cases, and there have been some children hospitalized, although not very common. And I want to talk about the potential link between COVID-19 in children and this post-viral syndrome, something that's been around for a very long time, Kawasaki's disease, but what's also new in children. And researchers and pediatricians are currently getting on top of this because they think it might be something that happens a couple weeks after having the virus as a child.
We're definitely seeing something new in communities that have been heavily impacted by COVID-19.
Now, classically, Kawasaki's disease is seen from infancy up to 15 years old, and it's very rare after that. Adults usually don't get it, but anything is possible. The big complication, the big thing you want to prevent by getting treatment early is heart aneurysms and heart failure. And there's been a huge spike in the UK that was reported, and then there was a spike in Italy. New York had 15 cases, New York City, and this is a very rare disease, very rare. As well as DC, Detroit, they're noticing a spike in things, and many pediatricians are wondering, is there some sort of correlation? Now, I'm not claiming that there is one. Maybe when you're watching this, there will be a confirmed correlation. But I want to explain what it is, because if your child has this, complications can be greatly prevented if you get treatment right away. So please don't miss any of these signs. So typically in classic Kawasaki's disease, there's a constellation of a child having red eyes, a red tongue, red lips, a red rash on the skin, peeling, especially on the arms and feet, and then on top of that, a fever. And then typically the fever will last for days, and diagnostic is over 5 days. But if you see a child having all of these symptoms together, it's an emergency. I highly recommend going to the emergency room right away, because if not treated, it can lead to something called a coronary aneurysm, as I was talking about, and lead to heart failure. Most times when you treat Kawasaki's disease, no complications, everything is good. There can be irreversible changes that happen to the heart, but that's not as common. But what's been being seen in different places, according to different pediatricians, is that there are patients coming in with all of those symptoms, as well as low blood pressure, being in something called shock. And that's what's dangerous, is you also have to treat that in a critical environment and make sure to manage a child in that emergent situation, because being in shock as well is very dangerous. And so if the coronavirus is related to this Kawasaki's superimposed shock-like picture, it will teach us a lot about Kawasaki's disease, because there's not an exact link that's known about the correlation between Kawasaki's disease and why it rarely appears up in children. It has been noted to be something that coincides with other viruses, but if there's a wave of post-viral syndrome in children, then that would give a lot of answers about what Kawasaki's disease really is. Like I said, the big thing to look out for in children is red eyes, tongue, red everything, rash, as well as a fever. Please do not delay going to the emergency room. It's not worth putting your child's life at risk. I want to make it clear that what I have learned as a medical student is that the earlier you go, the better, because there is treatment, and it can send kids right back on their feet, move on with your life, it goes away. Now, that being said, is there a difference with this potentially new form of Kawasaki's disease that's post-coronavirus? I'm not going to make any statements, but I will say look out for those symptoms and do not be afraid to take your kid to the ER. Don't worry about getting exposed to the coronavirus. Worry about it, be cautious, but don't let that hold you back from getting your child medical attention. With that, thank you all for watching. I'll keep everyone updated on what's going on with this and if it's true or not. Although the fact that many different pediatricians in different locations have seen this rise, and there have been many cases, makes me think that there really could be a tie. And a post-viral 2 to 4 week window after a child having asymptomatic coronavirus exposure could be a link. And they're still testing, looking at antibodies in children to see, is there a correlation? I'll let you all know. Thank you for watching, and I hope you all are doing well. If you like this video, please subscribe and hit the like button.